All right, everybody. Well, welcome. We stopped the rain just for this monumentous occasion. Thank you all for being out here. For those of you I don't know, I'm David Jackson. I'm the president of the Boone Area Chamber of Commerce. There is no greater partner of ours here over these last several years, especially, but even longer than that, than AppHealthCare. So to be here with them, to celebrate what has been, I remember when this was first theorized and talked about, and now to sit here and see this and understand the value that this is going to bring to our entire high country community, especially a lot of those places that are a little harder to reach and a little farther away from some of the central locations that AppHealthCare services. This is going to be a tremendous lift there. And this has been the summer of vehicular ribbon cuttings. We were joking earlier in the office that we would like to race this against the Apple Cart double-decker bus. There's just not enough straight road in town to do that. So maybe another time. But I want to turn things over to Jennifer Green. Again, a tremendous partner of ours, and one of the leaders that we look up to in this community, certainly on a daily basis. So congratulations to you and your team for getting to this point, and we look forward to working with you even more in the future.
Thanks,
so,
David.
Thank you.
Thank you all for being here. This is a big day for us. We're really excited. We had this vision of trying to make sure that we don't have barriers for people to get care. And I'm a big believer in that. Some of you guys know I've grown up here and see what it looks like out in not in the town, but way out in the sticks, as we call them. And I think that it's really important that we don't just always expect people to come to us, but that we go to them. And we want that for everybody in our community. So we've got some amazing people who have helped put some work into figuring this out. The amazing team at AppHealthCare, even down to the detail of what the bus looks like, what type of trees look like the ones up here at the Appalachian Mountains, to make sure it fit with our culture. So this is really a example of what happens when you collaborate. The funding that came to support this came from our wonderful county commissioners and their opioid settlement dollars, as well as the funding that we got from the health center program through a competitive grant process. So shows how we can work together and leverage those dollars to be able to serve more people. This is going to be a unit used in Watauga County, and we'll talk a little bit more about where, but also in our other counties. We serve Ashton, Allegheny too, and so we feel like this is going to get a lot of miles, literally, out of it. And we're very excited for that. I do want to call up Jean Supin, because Jean is on our Board of Health. Without our board, we really wouldn't have the ability to do these innovative projects. So Jean, I want you to kick us off with a couple of comments, if you don't mind.
I'm Jean Supin. I'm on, as Jen mentioned, I'm on the health board. And so on behalf of the board, we are just incredibly grateful and incredibly excited about all of this. First, I'd like all of the staff to raise their hands. And so I want to thank each and every one of you, not only for the work you do every day, but also being instrumental in making this all happen. And then a special thank you to you, Jen. Amanda, where are you? Amanda Gentry's hiding back there. Another thank you, again, on behalf of the board. This is just very cool. And I will say, you know, I've always been taught for my whole life that my worth as a human, as a member of a community, is not based on, you know, my wealth or my flashy exterior or my power or my education, but rather my worth rests in how I care for my community and for those less fortunate than I. And that is an ethos that is embedded in public health, and it is one that Jen lives every day, as do all of you who work here. And so while this is a very cool vehicle, and it's beautiful and it's full of all sorts of bells and whistles, which I like. At its core, it is just an expression of the commitment to serving those who need our help and need connection and need health care. At the end of the day, it's not about the flash, it's about the community and the connection. And I'm so grateful, again, on behalf of the board, for the vision, for the grant writing, and for the design, and for making this happen. So thank you.
We're so pleased to have Congresswoman Fox from DC here with us. Thank you so much for making time, and happy for you to give some comments. If you'd like.
Thanks. Well, today I'm from Upper Fosco. That's what my daughter calls where we live. We live out in the community where my husband grew up. I grew up in Avery County, as a lot of you know, I think, extraordinarily poor, both my husband and I. And public health care in those days was a lot more significant than it has been in more recent years. But we really relied on public health care in these communities, in Avery, Watauga, Ash, Allegheny. And so I'm really pleased to see this mobile unit being developed, because I understand that. I actually think a long time ago, I'd have to go back and look, tuberculosis was a horrible disease in this area when I was growing up. A lot of people had tuberculosis, and people, I'm not sure, Jennifer, but they might have had a mobile unit in those days. I can't quite remember, but I do remember we had to go in to get x-rays a lot, and they came out to the schools, I think, to do it, because tuberculosis was such a big issue. So over the years, we've had problems in rural areas with different kinds of diseases. And we were talking on the mobile unit about how important prevention is. And hopefully, one of the things that can be done with this unit is, when it goes out into the counties, is to be able to help people identify in advance some issues that they might be facing and try to do something for prevention. And Melissa and Jennifer and I were together yesterday in Allegheny County. I was over in Allegheny, where I was seeing another innovation that's been brought about by AppHealth, which is a clinic in the elementary school, which is another great thing. Look, healthcare is a huge issue. We all know if you have good health, your life's going to be so much better. And there are lots of quotes about that, and I didn't write one of them down. But we do need that, and in rural areas, it's important that we make sure people get that access. So I'm really pleased to be here today for the dedication of this unit. I'm looking forward to hearing about all the good work that it's going to be doing and getting out into the counties to see people. I hope that folks accept it very well and that it's well utilized. And I want to thank all the people involved with this too, and comment again on the collaboration. That was a big issue yesterday in Allegheny. The school system working together, the county commissioners, AppHealth finding grants. It's the way we have to live. And I always say, in the mountains, the people who live here have always had to be very creative to survive. And that creativity continues. So I thank you very much for this, for inviting me. And as I said, just came from Upper Fosco today. And I'm really glad you're on this side of town. So it's real easy to get to the Poplar Grove connector. And I can remember when that building down there was a Winn-Dixie. So thanks, everybody.
Thank you. Brendan Riley is here from the North Carolina Community Health Center Association, and we're really happy to have him because this is Health Center Week. Yeah.
It is. Yeah, thank you so much, Jen, and good morning, everybody. As Jen said, I am Brendan Riley. I'm bringing greetings to you from Raleigh, from the North Carolina Community Health Center Association. We are the statewide association of all of North Carolina's 43 community health center organizations, also known as federally qualified health centers, or FQHCs. It is National Health Center Week, so we're here to celebrate. What better opportunity to do that than this incredible ribbon cutting? community health centers have been serving America for 60 years as of this year. And AppHealthCare, I believe you've been serving through your community health center program 10 years, which is really a wonderful, incredible accomplishment. I think about the old adage about how we do things, right? If you want to go somewhere fast, you go alone. You want to go far, you go together. And so collaboration and partnership is the name of the game when it comes to the achievements that we've been able to achieve here as a community health center program and movement across the state. For some context, why am I here? Why did I drive all the way from Raleigh? Obviously, this is a really incredible achievement. We're so honored to be here with AppHealthCare, one of our cherished members, to celebrate this, and also to provide some broader context about what an asset you all have in this community and what a lifeline community health centers are for rural North Carolina and rural America. Our 43 health centers now, according to the data that was just released this week, we serve 800,000 North Carolinians every single year, providing them with comprehensive primary care services through a one-stop shop model. So we're not just providing primary medical care services and prevention, as Congresswoman Fox mentioned, the value of preventing and promoting good health, so to prevent chronic disease and manage disease, but we're also integrating other whole person services into that model: dental care, behavioral health services, mental health, addiction treatment for those who are living with substance use disorder, pharmacy services. Through the 340B drug discount program, we can help people afford and access their medications to better manage their health thanks to those programs. And enabling services, right? Not just what we do to help patients get to the clinic, but what we do to bring the clinic to patients. This is what the health center program is all about. We do this without regard for patients' ability to pay. So even if whether you have first class private insurance, whether you have Medicaid, Medicare, or you don't have any insurance, you're going to get incredible, world-class, high-quality health care when you come to a community health center. And the data show, I spent a lot of time in Raleigh crunching the numbers and reviewing all the studies. Decades of research show that community health centers not only achieve higher quality care and better health outcomes for our patients, but that we also do it at a cost savings to taxpayers. So we're not just saving lives, we're saving taxpayer dollars. And that's because we have a highly cost-effective, highly coordinated system of care that we deliver. And so when a patient of a health center, when a Medicaid enrollee gets their care at a community health center, we save the Medicaid program $1,400 a year per patient, because they're less likely to end up in the ER, less likely to end up in the hospital. They're getting the right care at the right time in the right place. That's what community health centers are all about. And it's why I'm so proud to be here to talk about this work. I'll close with just a few things as I reflect on what's gotten us here, right? It has been collaboration, it's been partnership, it has been, as you mentioned, Jen, county commissioners, it's been our state lawmakers, it's been our partners in Congress, like Congresswoman Fox, all of the policies and programs that make this possible. Partnership has gone a long way, and we'll need continued partnership to get another 60 years out of this health center movement. I want to thank our lawmakers for their support. Policies like the federal health center funding that we depend on have allowed health centers to continue to grow and invest in our workforce, as well as policies like Medicaid expansion that have improved our revenue services and our payer mix, allow us to be more sustainable. And of course the 340B drug discount program, which allows us to not only generate revenues, but reduce the cost of medication, which we know is so high and out of reach for so many patients. That has allowed us to grow our reach and our presence. While we're here to celebrate, we are facing some challenging years ahead. We know that the cost of healthcare, cost of living, the cost of competing for our workforce, especially in the rural and primary care safety net, is only getting more and more challenging and more expensive. And so we're going to need continued support from our partners in Congress, state lawmakers, and all of our partners in the private sector and public sectors. We're going to need continued support as we look at federal health center funding coming up for expiration next month, as we try to wrestle with the cost of doing business and making sure that we can keep our workforce in rural communities and in primary care and prevention. We'll also need protections for the 340B drug discount program to protect against pharmaceutical manufacturers poaching resources from rural communities, and to invest in our primary care workforce. So I just want to again thank you all so much. As we said, while we have these challenges ahead of us, we know that through partnership and collaboration with our public sector, with our private sector, with our business community, and so many more, we can continue to grow and make more achievements for better health, for better economic opportunity, and we're going to do it together. And this is such a testament to the value of the Health Center program and the collaborations that underpin it. So thank you so much. Here's to celebrating 60 years of Health Centers and 60 more with your continued partnership and collaboration. Thank you.
Thanks, Brendan. I'm looking for Amanda. Where's Amanda? Hey, come on up here. I want you to tell them more about where our plants are.
The driveway.
I know.
And I'm trying to help people get out. So, hey, I'm Amanda Gentry, and I am. Let's let these people get out. They've been so kind,
And patient.
and very patient. So, can you help them, Samantha?
Yeah.
Did not look good to hit the bus this morning.
That's not how you
No one gets hurt. Yeah. We have no doctor on call. In this, oh, I'm sorry. Karen's just here. No, I'm just kidding. Okay, that looks great. I think we're good. So, Jen was kind enough to hire me as the project manager for 10 months, and it's been a great opportunity for me. Thanks to Jess Muldowney. If you guys don't know Jess, when you need a data question, she's your person. So she helped us come up with where the need is most in our 3 counties. So thanks to wonderful fire departments, that's what we have, the amazing folks that do great community work. So Deep Gap Fire Department will be set up there on Wednesdays over in Ennis. Yes, the bus is going to Ennis. We are going to Glade Creek Fire Department, and we'll be set up there on Tuesdays. And Riverview Community Center, as you guys know, even though they've had a disaster with Helene, they've got one plug-in. They are kind enough for us to set up there on Thursdays. The great news about this is we can boondock and be self-sufficient anywhere. The other days, those Mondays and Fridays, will be like at assisted living. It'll be with our migrant workers. It'll be working with dental in the schools. So we're very excited. So if you go to the website, Melissa Bracey, as always, has made a wonderful web page for us. It gives you all the information, and you can share it with your folks. So any questions, you'll get to tour. If you haven't, we'll take you on a tour in a few minutes.
Great.
Okay, great. Oh wait, I'm sorry, for the mental health folks, sorry. We do have a mental health component as well, and we'll do mental health screenings and substance abuse screenings as well on the bus. So thank you. And as always, Jennifer Green, isn't she amazing?
Okay, so I think maybe now is the time to hold the ribbon.
Are you ready? All right.
Let's get the
All right, so